So, welcome everybody back to the last webinar of the year. We're in the midst of or let's start by having a conversation about pathology and about the differences between veterinary treatment, veterinary homeopathic treatment, and human. And Sue Beal and I were just chatting about a dog in Hong Kong that has chronic pancreatitis, Cushing's, hypothyroid, and heart disease, and how a human MD wouldn't go anywhere near something like that. And Sue and I were just thinking about how great it is that we get to treat that kind of stuff.
But, part of it's not that they won't go anywhere near it. It's that they don't often have the opportunity to go near them.
Yes, exactly.
I mean, there is some won't in it, I think, too. But also, just the way care is triaged on the human side. Homeopaths are not first responders, and usually, I mean, unless we're doing, Homeopaths Without Borders or something like that in crisis stuff.
The other thing to consider, at least in this country, is that a lot of the homeopaths are naturopaths. And for the patient, that is all out of pocket, especially Medicare patients.
Exactly so. Yeah.
So what were you using with it, Jeff? Apis?
Yeah, I was contemplating Apis at the time. Now, after hearing more about this is actually a relatively new client, and this dog just viciously attacked the owner. She actually showed me her bite wounds, which were numerous, and apparently the dog, out of the blue, has viciously attacked people throughout his life. It's not just that it's feeling badly, it's just, that it's acting like a snake. And it's got a lot of other laxus symptoms, so actually you're going to dose laxus 6C this morning to start. Oh, and he's thirstless, which is part of, and he had bilateral salivary mucoceles.
So lots of fluid accumulations in this dog.
Yeah.
Yeah.
That's part of why I was thinking about Apis for him. And I would love any, gosh, I mean, Pullman would be forever grateful for her any input on Bodhi. Her dog's name is Bodhi, as in Bodhi tree. In fact, there's on the web, if you go to Bodhi World, you'll be able to see the animated version of Bodhi the dog.
B-O-D or B-E-O?
Bodhi as in Bodhi tree, so B-O-D-H-I, yeah.
Oh, Bodhi tree, sorry, yeah, of course.
So, but
I had a really interesting experience on Sunday evening. I've moved to a shared house in Elmira, and the landlady and my housemate and I had dinner together on Sunday, and they having a really just kind of an all over the place conversation. And I don't even know how we started getting on. Oh, we're talking about people's dogs. And she was talking about living in New Mexico, in quite a rural area. And one of the dogs of a friend of hers who was quite aloof and didn't really like her and blah, blah, blah. And the friend was away working in the on the gas lines, and she was looking after the dogs, and came home to find this dog having been bitten by a rattlesnake. And she talked about picking up Don Hamilton's book, and that she had just brought home from the health food store that day in her truck. She opened the book up and looked at his, snake bite protocol, and she happened to have everything that was needed, and she happened to have a dose of whatever remedy he'd recommended, because her homeopath had suggested she keep it on hand for any kind of emergencies.
Mhm.
Anyway, she started dosing this dog who was moribund, and several hours later he was not as moribund. He was leaning against the wall, but he'd walked out of a room and gone to another place, and talked about the 24 hours after him being, and she couldn't lift him. He was 85 pounds, and there was no way that she could have hoisted him in to get veterinary care. I mean, the physical, it was quite impossible to do. Anyway, she treated him with remedy, and that was really her first experience using
Mhm.
using using remedy. It was quite
And he got
amazing.
up and survived and no sloughing and all that stuff.
Yeah, yeah,
Cool.
yeah, and became, she became his favorite human. It was really remarkable.
Rightfully so.
Do you happen to know, Sue, how often she was dosing him and
Oh,
how?
she dosed him every. I can clarify it, but she probably dosed him, whatever he said in the book, every 20 minutes or
Oh,
whatever for a
right,
couple of
got it,
doses, and
got it.
yeah, yeah, dry pellets.
Yep.
Yeah, and I had another client tell me about a similar story. She called me one morning. This is a good client whose animals had been under homeopathic care for, not quite double digit years, but certainly high single digit years. And she called me one morning wanting to know if there was anything else she should do about her golden retriever who had had a gastric dilatation the night before, and she had looked in Dawn's book and some other stuff, and she happened to know, she knows what obviously knew what remedies the dog had once way long time ago. Anyway, she treated this dog and through the evening and through the night and never called. And she was a local client and a good friend. It would not have been a huge issue to go out and tend the dog, but dog did real well through the night. She just wanted to know what she should do for follow up.
Well, that's great. Wow.
Amazing. And those
Wow.
two, I mean, you think about those two things that in most people's paradigms would have been great consternation and excitement and trips to the emergency clinic and a lot of adrenaline being burned and all of that sort of thing. And I'm not that folks' hearts weren't beating a little bit faster, but they were just so calm about the whole thing.
So I want to go back to the paradigm shift in a minute, but first I want to contrast that with Tucker, a 11-year-old boxer with a brain tumor that I've been treating off and on for a couple of years, and did really well. And the tumor was shrinking. And by the way, the dog has had chemo, radiation, multiple suppressions. She contacted me. I just spoke to her today. The dog had not only that tumor, but an mediastinal adenocarcinoma, hypothyroidism. Actually, the reason she contacted me is a patch of Demodex.
That
Yeah.
is a pup.
The dog is on 20 milligrams pred every day, multiple
Oh,
anticonvulsants, and multiple other drugs every day, including diltiazem for, cardiomyopathy and syncope. But here she is. We spent, a long time on the phone. She's fully on board as per right now. And theoretically, and we talked about this multiple times, she had the paradigm shift of that Sue just mentioned, but obviously or clearly didn't. So I'm wondering, Sue, what you think from your point of view helps people have this paradigm shift?
I can tell you my experience.
Yeah, that's great.
Yeah, my experience generally is that desperation is a great motivator. And and I have a certain number of people, and I can say this, 25 years down the road, like the H road, the homeopathy road. It, it- you know, you would get some people who were, the quintessential study group ladies, or who loved Dr. So and so so much or whatever, and they wanted to do homeopathy. But But a lot of the people that came to my practice came because they'd come to the end of all the light that they knew. And they tended not to come for first complaint kind of things at first. They tended to come with cases much like the ones that you've described this evening, a quite a laundry list of significant diagnostic labels. And it took a while until folks were were ready to do healthy animal care, or ostensibly healthy animal care, for stuff that wasn't a scary diagnostic label. So I think that's part of it. The other group that I would see were people who hated conventional medicine. Um, Conventional medicine was crap, and they were blindly, just crashing along doing anything but that. Hated veterinarians, hated conventional medicine, hated the medical system, and they were driven. They were driven by a different drive. Their motors are running a whole lot differently than than the folks who truly, had come to the end of all the light they knew. And those, I think it's interesting. I think retrospectively, those individuals, those groups needed a different kind of case management too, to 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 interface with the human parts of the equation. And
Did they arrive like with a suitcase of supplements?
usually, yes,
Yeah.
usually,
So
yes.
here's the question related to what you just said. You helped, they arrived, the first one arrived at your door because, and as did these two, um, because you're the last resort. You help them. Then they go off and do the same thing that landed them with you in the first place.
We could nurse that. We could get that animal to the end of their life, however long that was, months, years, whatever. And they'd get a new puppy. And initially, folks, because a lot of that practice was sort of referral. I wasn't their primary care veterinarian, blah blah blah. Yeah, and it took a little while for folks to start to think, oh geez, I got a new puppy. Maybe we should think about going down this road earlier rather than later.
Yeah. Anyone else? Jane, can you hear me, Jane or Robin? You guys have a lot of experience as well, and I'm wondering if you have any input as to how to help the clients make this paradigm shift.
Well, I don't know. I still, I'm almost 30 years in, and I still don't really understand humans. I had one today that was just really so bizarre. So she brought her husband along, and I ended up sitting in the exam room with the husband talking to him, and my assistant trying to talk the client down in the other room. And it turns out they're married, but they don't even live together. I mean, the whole situation is just so weird. You're talking about the paradigm shift where they get that they'll have a healthier, longer lived animal using homeopathy and natural diets and such, rather than doing the allopathic vaccine dance and all that.
Yeah, basically, and the paradigm shift that allows them to stop asking, what's the cause? What's the cause? What's the cause?
Oh
If
yeah.
they understand that they know what the cause is, they just don't know what the associations or triggers or the context of the disease is.
But I tell them when they ask me what caused it, if I see in the record that it's obviously suppression or vaccinosis, that's what I tell them caused it.
Right.
And sometimes I'll say, well, we can find out more if we do this or that test. Well, I'm in an area where people have very low incomes and not much education. So most of my clients come to me because I'm here. They don't, and what they get is homeopathy because that's what I do. So
that was a lot of my local cases were like that too.
Yeah. So of
course, I have other cases where people are seeking out homeopathy, and it's like Sue said, there's people who are most of them are either they immediately know they don't want to do the allopathic plan, or they've gone through a whole bunch of things and now they're trying something else because the prognosis is so bad. So I don't get a lot of people who hate veterinarians because they just don't come at all. I do get people who are fed up with allopathy and stuff, but most of them are either just coming because of that's the closest place to them, or they are, like she said, desperation is a great motivator. And those are some of my best clients. I have a lot of times where even if the animal goes on to die, as predicted by the allopath, they still come with their other animals a lot of the time. And I just, I do spend some time explaining about what the main thing that I think was really missing from my veterinary education, which is, the nature of disease progression and healing, which we never got, and when I can point to things right in the records that they're bringing and say, okay, well, look at this, this problem started 8 weeks after 5 vaccines, and there's this light that comes on, and they get it.
Sometimes I find that folks intrinsically knew that, but had never been in a position to have that sort of niggling gut feel validated.
Sometimes, yeah, but a lot of times I think they don't, especially the doctors whose records are sent to me. They're the ones that wrote this stuff down, and they don't put it together.
I think the clients, though, I think a lot of clients that end up looking for.
Yeah. Some of them do say, gee, I always wondered about that. Why do we have to do this every year? I don't get the shot. I don't get a measles shot every year or whatever, So, and I also have a really fun snake bite story.
Oh, please tell.
This guy brought a Jack Russell Terrier, a young one, and he had seen this happen. It had been bitten by a copperhead in the eyeball.
Oh.
And so I'm looking at it, and he brought it immediately. So I'm watching this dog's response to this snake bite, right? And I figured out the remedy that I wanted was Naha, but I didn't have it in stock. So I was like, wait here, I got to run to the local homeopathy store and get it, So I did, homeopathy works is 4 miles away. So I jumped in the car and I called him ahead, and I ran and got it and came back and gave it to the dog and had him give it. And it was dry pellets, and I don't even remember how often I told him to give it. He wasn't my client. He goes to another vet in the next town over, and so I didn't get any follow-up, except for I did see him. I told him, well, I forget. I know that the eye was saved. I didn't get trashed at all, but I was really curious about vision, and I never got to find out if it was his vision was damaged or not. And it was just, I mean, you could see what he was there for a while, and so after I gave the first dose, you could see this whole process just stop. This kind of swelling and stuff that was happening, and the dog got more comfortable, and it was very interesting. But it was too bad I didn't get follow up because the kid went to this other vet.
Do you remember what made you pick nausea?
It had something to do with the way the swelling was happening and the way the dog was acting.
Are you ready for another rattlesnake story?
Sure.
For those of us who are in Florida. I have
This is This is Robin, right? Hi, Robin.
Yes, it is. Well, you guys keep switching around. It looks like I was speaking when I wasn't speaking before, but so I don't know who's speaking when, but so I'll say a couple of things. But the rattle, this was another rat terrier. I guess they're prone to be in a lot of trouble, as we all know. And a really good client of mine, who's still a really good client, and her rat terrier, who is a long-term diabetic on insulin, got bitten by a rattlesnake, and of course she came and called me desperate in the evening. And anyway, she brought the dog in, and this one was bitten in the mouth and near the eye. It wasn't on the eye or in the eye, but near the eye. And of course, I felt concerned about being a liability issue, so I asked her if she wanted to go to an emergency room and get anti-venom, et cetera, and to cover my butt. She insisted no, she didn't, and I thought, oh shit, this diabetic, and this is going to be a mess. And anyway, I worked the case up and the way that the dog looked, and had to act pretty quickly. And I did choose Crotalus horridus, and the dog made a complete recovery without ever going to the emergency room. And I of course I wanted to release myself of liability, so I said to her, "You understand this is a really bad situation." And so the dog did get a bit unregulated with the diabetes, which wasn't a surprise, and I warned her about that. And but she has an awful lot of dogs and does a lot of rescue work, so she has the most broken of broken. She's mostly a pug person, but so I've treated a number of her dogs, but she's not necessarily a client that can be on board all the time with doing absolutely everything with homeopathy. The other thing that I wanted to contribute, that I'm not sure if anybody discussed it because I came on a little bit late in the scene here. I think as far as making paradigm shift, I
Oh,
Just lost you, Robin.
you lost Robin. Yeah.
The audio has been really funky. I just got dumped and brought back on too.
Okay. So we heard Robin. You said what you find about making the paradigm shift is, or
are we still together?
oh, there you are.
There you are, Robin. Maybe.
Shelly, any Delaware rattlesnake bites?
But when you
We have copperheads, I think they are. And I think haven't seen any, but two of them I think occurred when I wasn't working. We have a state park across the street and there's water, and every once in a while a dog sticks its head or paw in and gets bitten. So I haven't had to treat any. It's very, very uncommon.
Sticks its head or paw in what?
In the water.
In the water?
Yeah, right next to the water, where the
copperheads
snakes are.
like wetness a lot.
Oh, well, they also like plenty of places that aren't wet.
Yeah. Yeah.
And
See,
you have rattlesnakes in Delaware too.
Well, I got to tell you, in Maine, we don't have poisonous snakes, so I do not have one snake story.
No,
But-
like squishing by pythons or anything.
No, well, maybe we have those, but they were brought in, which is really nice. I don't like poisonous snakes. And the other interesting thing about paradigm shifts, Maine is a poor rural state. And because we're poor and rural and we're cold, historically, doctors don't want to come to Maine. And if you're a foreign grad, at least in the 40s and the 50s, there were only two states you could work. And one was Nebraska and the other was Maine. And when I started studying Richard's course, that was 93, I was taking an art class, and I told the instructor that I wouldn't be there all the time because I was taking this course and there's a lot of work and blah, blah, blah. And she said, "Oh, what is it?" And I said, "Well, it's called homeopathy." She was from Pennsylvania. She had no clue what I was talking about. everybody in that class knew exactly what I was talking about. They were all raised by homeopaths. And that was, that was only what, 20 years ago. And Maine being the way it is, a lot of people still have like kits and stuff. They may not know homeopathy per se, but they know that this is what their grandmother gave them. This is what their mother gave them, depending on how old they are. And they're pretty independent, and most of them can't afford conventional healthcare anyway. So then you get the other group, like the people along the coast, which are all the people from away, and they want conventional stuff. So I see a real mixed bag. A lot of people know stuff. A lot of people bastardize, but they still use it, and they're pretty independent. So it's an interesting mix of clientele.
One of the things that I think that we tend to forget about as clinicians a lot of time is that, I've said before that we work at the intersection of the pathology of the clinician, the patient, and the client. And I've said before that part of our work is to help people be brave in situations where it's difficult to find bravery sometimes. But the other thing that I've been thinking a lot about again lately is just that sort of necessity of letting people experience their own journey, ever what that is, and at ever what pace that might be unfolding for them. And that's really hard sometimes. You either want to push them through the knothole or pull them through the knothole, or and part of it is just letting stuff unfold in perfect timing, and recognizing that you know that everybody's got their own path they got to tread, and that stuff unfolds in the fullness of time, and just they need to have their own experiences. They,
They they
humans,
they
animals
are.
too, actually. That's another larger conversation.
I
That's so
have.
true in a lot of different aspects of life.
Yeah,
Yeah.
they are our clients are the gurus and we are the gods. That's what a yoga teacher said a couple of weeks ago, and that's so true, I think, for us as well. They let their veterinarians be the guru and do whatever they say, and the reality is that a lot of our clients know how the body heals better than a lot of vets or some vets.
Well, and I'm not sure whether that's whether that's a client bucket and a veterinarian bucket, but I think that in the human bucket, there's some humans that really understand that whole experience, even though they may not have the fancy words to attach to some of the things and stuff. And so I'm not. Yeah, I think it's a human thing, not necessarily a client veterinarian thing. Some humans understand that and some don't. And some of the humans that understand that happen to be veterinarians and some aren't.
So how many of you I've had a bunch of these recently. They come in, my dog or cat isn't right, and you start questioning them, asking why, what do you know? I don't know. Are they eating? Oh yeah, same. Vomiting, diarrhea, coughing, sneezing, and you're not finding anything, and then what, 2 days, a day, 2 days later, something breaks, either cystitis or diarrhea or something. I mean, and it's not unusual. I had it when I was in Massachusetts too, that just some clients are so intuitive about something is off, but they kind of get them to you a little too soon for you to pick up on anything.
I had a client one time say to me, this was very, very soon after I moved to Pennsylvania, and they came in and they had they had a hound dog, so he would have been a chain dog from the backyard, well looked after and all of that sort of stuff. And he put the dog up on the table, and he was telling me the dog was just a little bit off, and I was kind of doing all the in the box sort of stuff. And he finally looked at me. He says, "Sue," he says, "use the other party and figure it out."
Yeah.
Yeah. He says, I would have thought you would have used that other part that you use. Laugh.
What does that mean?
That part of me that's quite intuitive, um, and rather than the part of me that's intellectual.
Uh-huh.
And I think, I believe fully, and I see it in humans all the time, that we have both of those components, and the potential to access both of those components. And sometimes when we put our stethoscopes around our necks, we don't allow that part of us to be present. And God knows, most of the time it gets trained out of us in the academic world. So.
Yeah.
So we've got a
But
bunch of
yeah,
other.
I see that, Judy. That people come, like he ain't doing right. I had a pug person come in one time, and called, and we finally got around to, like, well, why did you call? And he said to me, Doc, his tail's coming unscrewed, and he always carries his tail this way. And I laughed. I said, yeah, because my late ex-husband and I had pugs for quite a number of years, and I knew exactly what he was saying, and he was really happy to know that I knew. I used to have clients bring me skunks down from Erie, and they finally got to the point where they would say, yeah, they brought them because their tails were, instead of being held this way, they were being held that way, and that's how they knew they were starting to go off.
So what I was going to say is a bunch of other people, or we have a few other people that have joined us. So does anyone, because there's a few people that haven't gotten to speak or share cases or questions, and I don't know if you have any general questions or cases or anything for us to discuss tonight. Which is really the last AVH study group webinar of the year, and one of the best times to get input from your colleagues, and some esteemed colleagues like Judy and Stephanie. Stephanie, we haven't heard from you. Do you have any rattles in Northern California and rattlesnake bites stories or cases?
We do have snake bites here, but I haven't had any cases in years, so I don't have any stories for you.
Okay, any and Robin, can you hear me? Or maybe I should say, can you? You could type in the chat also. I actually forgot to open that. Anyway, does anybody else have things, cases? Shelley, it was great that you joined us, and wondering if you have anyone or anything that you want to discuss.
No, I'm good. I haven't been at work for a couple weeks. So
Sue, you wanted to talk a bit about case taking, or does that?
Yeah, and Jane had a case or something from last time too.
Oh, well, I don't remember.
Okay.
I had a really rough couple of weeks here. So my niece died last week, and it's just
Oh, sorry.
grief combined with a little compassion fatigue. I'm kind of feeling a little beat up. So I
Hmm.
don't remember what I suggested last time. If I could remember, I would be happy to talk about it. But
And Sue, anything?
Yeah, we could. One of the things that I'd be curious about, as this year is wrapping up, and we're actually starting to think about things for next year. If there were any particular interests or hot topics that people would like to discuss, or any particular people that they would like to see, if we could convince to join us, to lead a presentation or anything like that. And I just be curious about things that folks find useful clinically, things that they get stuck on, things that would be meaningful for them to talk about. And I'm happy to have folks raise that here, or if they would rather communicate privately, to just send me an email, at alchemy, ALCHEMY, at penn.com. And I'd be happy to either talk in voice or talk in typing with folks.
So I have a fun little case I could go over. It's cured, but it's just a fun little case if people are interested.
That'd be great.
Okay. So this is I think it's a 14-month-old golden retriever, and it's either a male or female, spayed or neutered. I can't remember the details. Oh, I think it's probably a girl because I think the name was Cookie.
One of those.
There you go. And Cookie came into me first, maybe, I don't know, a month and a half, 2 months ago. I can't remember now. And the story was in July, they picked the dog, was it July? Or the end of August, they picked the dog up from boarding, and it had a wart in its mouth. And then they could see two other little ones. These were all on the left side. And so he had called me up, and what I do is a 10-minute quick phone consult to decide, is this going to be homeopathy or just general holistic stuff, or how are we going to handle it? So I said to him, okay, come on in, because what I do, I learned this from the CAM forum. We're seeing a lot of oral viral papillomatosis cases because of the puppy parks or the dog parks in the area. And until we had dog parks, I wasn't seeing any cases of this. So this dog apparently picked it up from boarding. And mind you, it's a golden retriever. So I'm just throwing that in because I think that's important, boarding plus golden's combination. Anyway, so what I told him to do was come on in, and I do this thing where I crush a wart with a hemostat and I give a dose of Thuya 30C. And I'd say about 90% of cases are better within 2 weeks when I do that. And it's just a shotgun treatment to help the masses, because we see so many cases of this, and these are not necessarily homeopathy clients. Now, he was totally open to homeopathy, being from Brazil, where they use a lot of homeopathy. So I did it with the dog. I didn't think I got a great crush in there, and it didn't do anything. We were starting to see more warts. So he brought the dog back, and he said, let's just try a bigger crush. So I did a bigger crush on the dog. And then he said, it's just not working. So now we're maybe 3 weeks later, and he brought the dog in, and it had a whole bunch of very clear warts now on the left side, and was starting to get some on the right. And it was mostly the lips and the commissure of the lips on the left, and a little bit happening on the right. So I said to him, we need to do a full homeopathy intake now. And he was totally amenable to that. So I did the intake, and I'll give you what I can recall, because I don't have the case in front of me, but what I recall as the symptoms. It's a 14-month-old golden, happy golden retriever. And one of the first things he told me was, when the dog's excited, like when he comes home, the dog will piddle a little bit. And I thought that was striking, because it's not a Cocker Spaniel. And 14-month-old golden shouldn't be doing that anymore. And, it's a golden, very, very happy dog all the time. Even after you crush the wart in its mouth, it was still very happy. And that's a golden retriever. And just as an aside, you guys might already know this, but there's a gene in people that they found where people are just really happy, and they'll go up to all different strangers and just be friends with them and everything. And apparently that gene is found in golden retrievers as well. So sometimes, especially if they still really love me after I've crushed a wart in their mouth or done something evil, I think that can be significant. So And I asked him a lot of questions, and I'm not remembering the whole case here, but first of all, I thought, okay, this happened when the dog was boarding. May have nothing to do with the fact that it was boarding and just it played with another dog, or it might have contracted it before boarding, and now, it was sort of like a grief kind of thing because it was boarding. And the other thing, I asked him the sympathetic, empathetic questions, and it turns out that twice, once when his daughter had hurt a leg and had ice on it, and another time when she was running a fever, the dog came up and licked her and laid next to her. It clearly, of its own volition, went up and did this kind of sympathetic, empathetic thing. And that was the case. So, what did I give the dog?
Anacardium.
Anacardium.
Would you start at the A's, Jeff?
Yeah.
Is it safe to assume that the dogs that were boarded also got a whole bunch of vaccines before they were boarded?
No, I don't think there was any vaccine connection in this case.
Okay.
I don't remember offhand, but I always look for that. And he probably did minimal vaccines anyway, but I don't remember. But I can tell you there wasn't. It wasn't like a clear vaccine thing there. Which I think in retrospect, I said to him that could be why the Thuya wasn't as effective in this case as it's been in a lot of others.
Right.
So I know there wasn't vaccines, yeah. So what are the symptoms? What are the main things that we have with this dog? What did it come in for? In the mouth. A tongue, right. No, come on. What did it have in its mouth? Warts, right? So warts and
And that went from left to right.
yeah. Which ended up, I have to just say, not being helpful, but
Yeah.
but yeah, there's that. And what else?
Well, I want to hear more about this gene that you're telling
I
us
want to
about.
hear more about papillomas, dog parts, and boarding because that's a whole
Oh,
other. Yeah.
So it was sympathetic, and it has the urinary incontinence with excitement, which I thought was unusual for a 14-month-old golden. A golden puppy is one thing, but 14-month-old, it should have outgrown it, and it's not a cocker. So, and I'm just actually real quickly looking something else up here.
I want
Just to
to. Yeah.
So what?
I'm actually checking a rubric because to see if it's just checking a remedy to see if it's in the.
I actually used a few different repertories on this one because, sometimes you're just not sure when you have these young Goldens that are acting like Goldens.
so Lauren wrote pulsatilla. So
That's
Lauren, do you wanna tell
that's
us?
what I was thinking.
Yeah, do you want to tell us why?
Oh, can you hear me?
We can, yes.
Oh gosh, that worked. Yeah, I was just thinking about the incontinence when excited in a youngish dog. I just had a little puppy that I treated that did the similar thing, and just with the consolation, reminded me of pulsatilla.
Consolation.
But then I was also thinking, just from our conference, that maybe it was one of the lack remedies, just because I wanted to touch the little girl when she was sick. So I don't know. Those are just my ideas.
Okay. Anybody else?
Well, are we? So are you also looking at the mouthwarts rubric, or you're looking at the urination rubric?
Me?
I was looking to see what warts it was, what warts it was in, what
Yeah,
was
and
in the
that's
wart.
tricky because it's on the lips.
It's on the
You know,
lip.
Right.
yeah.
Thank
And
you.
it's actually on the mucosal part. That's where these usually are.
Right.
But when you look up lips, are you
It's
looking up
not in the
mouth?
mouth.
They
Mouth,
said,
mouth, mouth, mouthworts, phosphorus, lachesis, staph sagra, of course. Yeah. So what'd you do, Shelley?
I gave it causticum
Oh,
30C.
Not the.
And what I did, because causticum is a big grief remedy, that's a
Yes.
it is.
causation for causticum. And I
Yes.
thought boarding, I've seen so many cases where problems happen after boarding. And it's a golden retriever and it's separated from its family, you know, even though they said the dog did great boarding, you know, it's still a golden retriever. So I gave it causticum because it has, you know, the urinary symptoms and it's a grief remedy. I think it might have had joyous in there. I can't remember. But what I found, so here's what I did, first of all. For those of you who read Javma, I know at least one other person here does.
Yeah. Has this
Um,
he's made it
I
into
lied. Anyway, but we are going to publish a really cool case. It's a pemphigus case in a horse, Pemphigus foliaceus. It's by Lisbeth Ellinger. Many of you know her. And she just gave phosphorus to this horse. And initially, and the horse was on pred and it wasn't responding. And initially, she gave one dose, and I can't remember the potency. It might have been a 200, I don't remember. She gave one dose, and the horse didn't respond at all. Like within 2 days, it was worse. So she said, I know it's phosphorus. So she had them, I think they prepared it in water, and she gave it 3 times a day, an hour apart. So 1, 2, 3, you know, over like literally a 2-hour period every day. And I think she did that for a few days until the horse really showed a great response. And I thought, this is a young, vital dog. So I've been using a lot of dosing in water. And in this case, I just had this gut feeling, like as Susan said, you know, just that part of you that's not the conventionally trained part. And I said, I want to do it 3 times a day, every day. And it, like within 2 to 3 days, the warts started to go away. And I talked to him, it was maybe a week and a half later, and they could barely see the warts. So he's keeping an eye out for the other signs now, like the urinary incontinence, because that wasn't where his focus was. And I said, that should all be going away too. So we'll see. But what I thought was interesting about this case, so you guys remember like all the Vijayakar stuff that we talked about? I'm not sure how many of you were at those lectures, but one of the things that I learned from that, you know, people might say, oh, causticum is a syphilitic remedy because, you know, you've got this and that and the other, you know, and you don't think of it as a young, vital dog remedy necessarily. But so one of the things that I learned was to go back and look at, you know, you look at each case and you think, what level is this case on? And so it was actually on a psychosis level because it had the warts. And the other signs were mainly psoric, you know, nothing exciting. And when you look at causticum, you have to evaluate the symptoms. And a lot of the symptoms we always talk about are syphilitic. And then there are the psychosis symptoms and the psoric symptoms. So you kind of match that dog to, you know, what the dog's showing to what the remedy's showing at that level. And it was clearly causticum. So that's my case. That's it.
Nice.
The sweet case.
Yeah, and
When you when you do those crush things with the warts, I've never had it happen in a case that I've been managing, but I've had some of my colleagues talk about when they crush the wart, either sometimes they'll crush the wart and make a remedy out of that wart, and sometimes they'll just crush the wart, and sometimes they'll crush the wart and again, usually a dose of Luya, sometimes nitric acids, you know, depends on whatever.
Right. If there's something more obvious,
Yeah,
yeah.
and that everything cleans up except the wart that had been damaged.
No, I've seen them all go away. And usually it's really amazing because if you look at the dermatology textbooks, they tell you like something like 6 to 8 months this dog can't be around other dogs. It's really bad. And usually it's 2 weeks. My niece's dog was 3 weeks. That's just because it's family. Um, and I don't think I've had failures. I mean, the last thing you ever want to do is remove it, because one of the first cases I saw in practice, and again, I hadn't seen any cases for probably 15 years of practice, but it was a litter of, think they were Ridgebacks. It could have been Vizslas, I can't remember. And the whole litter had it. And there were 3 cases I knew about. And one of them was a horrid case where it had these huge pendulous warts that the dog was chewing on. And so the vet removed the biggest one, and then it got more, they multiplied. And I think they ended up euthanizing that dog, a puppy, I don't even remember. Another one was like intermediately treated, and I can't remember. In the third one, the owner immediately gave it homeopathy and it got better. So it was just like a textbook of what to do and what not to do. And then since then, I've just seen so many cases because of the puppy parks. And when you crush it, I think what happens is you're now somehow or other exposing in a small way the body, the wart to the immune system. I mean,
That's
I don't know.
that's an
So,
old way to do with warts on cattle and warts on horses. I mean, that if you go back in the sort of the old folk literature, and well, even on humans too,
mhm,
especially if there's crops of warts, is to go in and smash a few of them, and quote, usually they take care of themselves.
uh-huh. Yeah,
Yeah.
and so you're at least, making the body heal itself.
So
But
so
well, I was going to say I've never crushed a wart, and I've been around the block a few times, and I've
Oh, you're
seen.
so missing out on a vital part of life, Judy.
I know.
Sorry.
I, that would be so much fun. But the ones not that I see a lot of them, but the cases that I've seen since I've been doing homeopathy, I've just used homeopathy. I haven't crushed anything, and they go away within a week or so. And
Yeah,
uh,
homeopathy.
and you know what? I've also seen them go away all by themselves.
right.
In
Um,
how long a period of time, though?
well, I'm trying to think ancient times when I was in Mass, and there was this young dog. It was within a month.
Yeah, and this dog was actually getting worse. They were multiplying, left to right, all that
So
stuff.
Yeah. Yeah, but
so
And
back
and then
then I was doing
clear change.
LMS.
Yeah.
so Shelley, what do you think in the bigger picture when we look at dog in general? What do you think the fact that we're seeing all of these warts on dogs, quote, from dog parks and boarding? I mean,
Yeah.
uh, what's that say about the population in general, and what's that say about the seat of disease?
Yeah. Psychosis. I think so many of the things that we're seeing these days, like mast cell tumors gone viral, maybe literally,
Mm.
I think that's definitely related to vaccines, affecting the immune system. And I think one of, just, to get off on this tangent with 7 minutes remaining in the webinar, is first of all, we see a ton of pit bulls, probably like the number one quote unquote breed. And pit bulls have a really awful predilection to mast cell tumors. What's the thing that veterinarians like to do is remove them. And I have a pit bull with, I'm sure, 2 mast cell tumors, and I won't remove them. And I throw fits with my staff because, with the other doctors, because they remove it and they come back, and we know that. And the surgeons will
If you're
tell you,
lucky, they come back.
Or you get 2 or 4.
oh, you can, or I had one where I actually removed it for one of our vets who doesn't do surgery, and she knows I don't like doing that. So I got on the phone and I said to the owner with the biopsy, it's a grade 2. We're not going to remove any more of these that come up, because then it was my case at that point. And she said, okay. And a month later, the dog had lymphoma. Uh,
Oh,
And I had, like, it was 2 or 3 summers ago where I just had one case after another that came to me from the outside of tumor removed, like lipoma. Then the next one was a mast cell tumor. Then the next one was like, we don't even know because the owner gave up and the lymph nodes were huge and all this stuff. So, you know, I mean, we all know that. But with the mast cells, I wonder, you know, we know the lepto vaccines are very immunologically stimulating in a bad way, and they all cause hypersensitivity reactions. And what are mast cells? They're related to hypersensitivity reactions. So I wonder, even my pit bull, before we got him at the shelter, had a lepto vaccine. So I wonder if the lepto vaccine especially is stimulating mast cell tumor to occur. But yeah, I mean, I really think that these warts, I mean, they're psychotic, right? And this dog's was on the left side. So I think there is something to all that too.
I have a really hard time with warts in older dogs, especially these warty things that are on the face. The 2 young dogs that I've seen are well, one was a dog and one was a horse with huge amounts of warts on their faces after vaccine. That was just like so responsive to a high potency thuya. One dose, the warts fall off, they're done. But these older dogs that get them are just really, I can't get them to budge.
Mm.
But
Are you talking about getting them from vaccines or just getting them because they're older?
Well, yeah.
Don't be
You
too
know,
specific.
right. I mean, a lot of them have been somewhere else before and gotten over vaccinated. So I guess it's from too many vaccines, but you know, I don't know.
I don't think it necessarily has to be from. I mean, it's hard to separate it totally out, but I don't think that it's necessarily a vaccine mediated stuff. Um, you know, especially when you get some of those, nitric acid, causticum, calcarea type warts. I'm not saying the vaccine is totally removed from that, but sometimes I think it's just a superficial structural manifestation of their chronic disease.
I agree, and I was going to say that too. And one of the interesting things is when I see these local lesions in dogs when they're younger, and these are my clients, so I get to tell them don't remove it.
Mhm.
And I give them stories, some of which I've told you, but Bichons, for example, love to get warts like this. And you remove it, and they get one right back. Cockers, you remove it, they get 10 of them right back, including the one that you removed, and it comes back and bleeds a lot more. And one of the things that I found is, I tell people when you're not perfect, your body puts these on the outside, and it kind of throws the balance of the disease to the outside, and that's where we want it to be. And when your dog gets older and it comes back and it's 15 or 16, the little Bichon, and this wart starts bleeding, then I don't want you to say to me, you should have removed it 10 years ago, because I'm going to say, your dog's 16. But the other thing is I let people know that it's sort of a sign of what's going on inside. So if this little wart that maybe just secreted a little greasy stuff for all those years starts to bleed and get inflamed, they should look at it as a sign that there's something deeper going on inside. And we definitely don't want to remove the wart at that point, because then we're going to suppress it to the inside. So, I talk to people with that perspective, and a lot of people get it. They understand it, and they're happy that they don't have to spend $1,000 to have a wart removed.
Exactly. Yeah. So usually, and I always tell them, surgery is always an option. It should be your very last resort, and once it's done, it can't be undone. So,
Right. Yeah.
you know, so it's even if I'm talking them out of surgery, I pretend that it's still an option if things don't go well, and then I'll talk about it.
It's always an option.
Yeah.
Yeah.
Maybe a referral option, but yeah.
Right.
So we're winding down here, last webinar of the year. Anyone else have any comments or questions? I see that for Shelley's case a while back, Henry Kostecki is here, and he also suggested Costicum. So,
Yay,
yay!
Henry!
Yep.
You
Anyone
got the
else?
prize.
What's the prize for
I was going
tonight?
to say, Jeff is giving out the prize.
Uh,
I had a recheck today on a dog that I gave Cost to come, one of these older dogs, and it definitely did not help. It was the thing is worse actually. So, what did I give that dog? I think I gave her Calp Harb today. So we'll see.
I have a colleague that's treating a horse out west that has some of them are sort of warts and some of them are some sort of other weird excrescence as yet to I don't know what you'd exactly call it except a huge flipping bump. I mean, they're some of them are almost grapefruit sized, and Calcarea moved some stuff, but they didn't do anything until they treated with causticum, and the big ones were plum sized. Well, the middle sized ones were plum sized, and some of those big honkers that were plum size, nectarine size, actually fell off, and the rest of them are shrinking. It's quite interesting to watch, actually.
That's nice.
Mhm.
so I guess we'll wrap it up. And along with Sue's request for topics, then we can email Sue if you would prefer other nights or if we should keep it on the second Wednesday at 8, or which I guess we've had it now for a couple of years. So thank you all for coming.
Thank you, guys.
Recording will hopefully be, all the recordings will hopefully be on the AVH site sometime soon. And have good holidays.
Yeah.
Thanks for
Guys,
organizing this, Jeff. Thanks for doing this.
Well,
yeah.
thank you all for coming. You're welcome. I appreciate it too. And we will talk soon. Happy holidays. Happy Thanksgiving next week. Hard to believe.
Take care, everybody.
All right.
Thanks,
Thanks,
guys.
Lauren. All right. Bye bye.
Bye, everyone.